Did you know that 1 in 6 Australians are suffering with some kind of back pain, and that 80% of the population will at some point experience lower back pain or back pain in their lives? Lower back pain specifically is the number 1 cause of loss of work productivity and loss of income, the second most common reason for visits to a GP, and in the top 5 reasons for visits to the emergency room, and comes at a cost of almost $5 billion annually to the Australian healthcare system. I'm Dr. Andy, Principal Chiropractor at Soul Chiropractic in West End, and I'm going to be talking today about lower back pain and what can cause it, and some of the tips that you can use to manage your lower back pain naturally. So, first, let's get into some of the background of lower back pain. Often called non-specific lower back pain because it's not associated with an identifiable cause such as a fracture. This can make it tricky to treat because without an identifiable source of the pain, most interventions are focused on reducing the pain rather than actually treating the cause of it. Now, the good news is, though, that most lower back pain is self-limiting, which means that up to 75% of cases will go away on their own in time and won't cause any significant long-term disability. Now, the causes of lower back pain or non-specific lower back pain can be linked to many lifestyle factors, including trauma, repetitive movements, poor posture, stress and mood, sitting for long periods of time, lack of physical activity, obesity, and general poor health. As a chiropractor, when somebody comes to see me with lower back pain, I take all of these into consideration, as well as look at the general function of the spine. After being able to rule out any serious issues, I look at these structures here. So in the lower back, for instance, we have got 5 movable lumbar vertebrae, which are sitting on top of the pelvis, which is made up of the sacrum, these 2 big ilium bones here, and the coccyx down here. So the pain could be generated in any of these joints, which includes the discs, the little tiny facet joints, the sacroiliac joints, or even the coccyx. Now, if any of these are dysfunctional, they can either move more or less than they should normally. This could lead to pain, inflammation, disc bulges, and even wear and tear of the joints. Then surrounding all of these joints are soft tissues like ligaments, muscles, tendons, which can also cause pain, spasm, and tightness. Now, what's encased deeper in this is our nervous system. These little yellow nerves here coming out here. In some more serious cases, these nerves can be irritated, and that can be the pain going down the leg. So for instance, sciatic pain. However, just to look at where the pain is, so looking very specifically here, could be a disservice to you, as how the rest of your body and your spine is functioning, your posture, and also your other lifestyle factors can also have an effect on your lower back pain. So let's dive in now to my 5 tips to help you reduce your lower back pain. So tip number 1 is to keep active. So gone are the days of bed rest if you have a bad back. In fact, the research shows that's probably the worst thing you can do. There are so many different ways to keep active, and the key is to find something that you enjoy, that isn't causing you pain, and that you can maintain regularly. For some people, it might be going to the gym 5-6 times a week, and for others, it's a nice walk with the dog every day. Now, what movement does is it improves the blood flow and nutrients to the joints and the soft tissues. It releases endorphins, which are pain relieving. It increases strength, stability, and functionality of your body. Now, the caveat to this is that if anything you're doing is causing you pain, then it might not be the best thing for you right now. So either change it up or change the intensity. But even when your lower back pain is at its very worst, it's important to remain active. So we call it active rest. So you can still do things like gentle walks and gentle stretching. But make sure you listen to your body so you can push to the edge of the pain, but not through the pain. Tip number 2 is posture. Now, when your parents told you to sit up straight at the dinner table, it was actually for a good reason. With ideal posture, what we should see is a straight line that comes from our ear down to our shoulders, down to our hips, knees, and ankles. Underneath that, we should see the spine has a strategic series of curves when we see it from the side. So it should look like it's an S-shaped curve. Now, when we have changes in that alignment, we will start to load some of these joints, muscles, tendons, discs, and ligaments in the lower back differently, which could over time lead to pain, discomfort, or stiffness. Now, for some of us, if we've had really bad posture for a long time, it might be difficult to either get good posture or difficult to maintain it. So the easiest thing you can do is to pretend that there is a little string and it's pulling your head up towards the ceiling. So when you do it this way, you're less likely to over-exaggerate any of those curves. So you can think of it as not having perfect posture, but more just activating the right muscles. So little lift like that will make a big difference, but the key is to do it as repetition. So whenever you find yourself and you're slumping again, just do the same activity and maintain it. Tip number 3 is manage the pain. Now, this is where a little bit of experimentation as to what works best for you may come into play. One way you can do this is with hot and cold therapies. Now, the jury and the research is still out as to which is the best and when. So, however, the general rule of thumb is when it comes to hot and cold is if it's brand new pain, especially related to an injury, or you put your hands over the area and it feels hot to touch, then we may be dealing with inflammation. When we're dealing with inflammation, we want to reduce that, and that's where ice may be beneficial. Now, try keep the ice pack as specific as possible. Rather than a broad application, we want it to be where the pain is. Now, never apply it directly to the skin, and don't leave it on for more than 15 minutes. Now, you typically shouldn't have to use it for more than a few days to a couple of weeks at a time to get through that acute inflammation. Now, if the pain is more chronic or ongoing, then we may be dealing with some stiff muscles, and this is where a heat pack can help. For heat packs, you want to go for a more broad cover over the area with a medium but consistent heat, and you can do this multiple times throughout the day. Another way to manage the pain is through over-the-counter pain medication. But if you'd like a more natural approach, a really powerful natural anti-inflammatory is turmeric. And this can be taken in different ways. One way is you can buy the fresh herb and you can blend that into a smoothie. Make sure you've got some black pepper and some kind of fat like coconut oil in there as well. You can also get the ground herb from the herb section at your supermarket and make a drink out of that called golden milk. Try adding a little bit of black pepper as well and some kind of fat like coconut oil again to help make it more bioavailable in the body. Now, however, if you're lazy like me, capsule options are readily available these days from most health food shops and pharmacies, but like with most things, quality does matter. Now, as good as turmeric is, it won't work as quickly as other over-the-counter pain medications, but it can be taken multiple times throughout the day and generally is far more gentle on the body. And tip number 4 is relaxation. Now, the research shows us that the state of your mind can actually affect your chances of getting lower back pain and also the chronicity of that pain. And then, to make matters worse, the pain and lack of mobility and the changes in your lifestyle can also then lead to further psychological distress, which can worsen the pain. Now, psychological therapies with professional guidance can help, definitely, as well as getting into a regular meditation routine to help better manage your stress and mindset. Now, sleep is another very important factor, and it's often overlooked in managing and maintaining and preventing pain conditions. So you need to ensure that your body's getting enough time to rest and heal. Now, this can help with the healing process, your stress levels, and also to help reduce the chances of injury. However, for many, the lower back pain might then also affect your quality of your sleep. So in those instances, we recommend a good quality mattress that supports the parts of your body that are naturally heavier to help maintain those normal spinal curves and alignment while you're sleeping. Now, if you're a side sleeper, then something between your knees will also help to take that rotation out of your pelvis. And finally, tip number 5 is to see your chiropractor. Now, there is a very large database of research into the effects of chiropractic for lower back pain, as well as other areas of pain and function. Now, some of these studies compare against other treatment options like exercise, massage, physiotherapy, and medication. Some compare chiropractic against a control group that receives no treatment at all, and others just review all the available literature and put it into one study so you don't have to read everything. Like this 2011 Cochrane review here that includes 12 different studies with a total of almost 3,000 participants and demonstrates that chiropractic, at least in the short and medium term, is superior to the other modalities it was tested against. But the real problem with chiropractic research is that, as we discussed earlier, there are many joints, muscles, discs, and ligaments in the lower back here. So no two people are going to have the exact same cause of their lower back pain or need the exact same treatment. So a well-trained chiropractor will assess to basically see exactly where the pain is coming from and work with you to improve the function of that area through a range of specific techniques for you, and also to help you to maintain and stabilize that area with proper exercises and stretches. So if you've already tried some of the other tips that we've talked about and your pain continues going on and you're not getting results from those things, then it might be a good time for you to book in to see a chiropractor today. Now, if you found this information helpful, or you know someone who's suffering needlessly with lower back pain, please like and share the video so that you can help them to reduce their pain and the effects that may be having on their life. I've been Dr. Andy from Chiropractic, and I hope that this video helped.